Hey everybody. All right, so we're going to continue into pretty much the last main topic of this course, which is prodrugs and drug delivery methods. And after this, I think we'll have time for a couple of sort of just general drug examples, sort of integrate the various topics. And we've talked about prodrugs a few times in this course. The basic idea is that there are substances that are activated metabolically, and after administration, their metabolism kind of activates them and allows them to be actually reach their drug target and interact with the drug target. So metabolism is kind of a key feature of prodrugs. I've mentioned this book before. It's really good for kind of general organic chemistry of drugs, and it has a really good section on prodrugs. Some of my figures are actually taken from this book, Silverman and Holiday, 3rd edition. So it has lots of examples of metabolism, drug action, and I think the last chapter is on prodrugs, and we abbreviate this as SH9 for Silverman, Holiday, 9th chapter. This book is also good. It has some examples of sort of prodrug strategies, drug-like properties, concept, structure, design, and methods. Both of these books are probably, I'd say, kind of essential reading for medicinal chemists. Okay, so these are the things we're going to talk about in the course of the next couple lectures. First, kind of an overview of the concept of prodrugs. How are they beneficial? Why do we use prodrugs? Then we're going to get into some examples of something called a carrier-linked bipartite prodrug. So we'll explain what that is. It's usually like there's two components that are sort of attached. These are very common, and we're going to go through examples where they increase water solubility, improve absorption and distribution, site specificity, so interacting with the target of interest, drug stability, so it actually the prodrug stabilizes the drug, and also to slow or prolong drug release, as well as minimize toxic effects that might happen. And also, this seems kind of crazy, but just encourage patient acceptance. So what we'll see for this one is like drugs that are really kind of bitter or don't taste very good. You can change the structure a bit so that they don't have that kind of negative effect. Then we'll talk about something called carrier-linked tripartite drugs. And these just have like kind of 3 pieces to them, sort of like a drug, a linker, and a carrier part. And then we'll talk about bio precursor prodrugs. I should say bio. Oh, yeah, a little typo. Bio precursor prodrugs. And then later we're going to get into a couple case studies in the other lectures. Hydrogels and antibody drug conjugates. Okay, so what's the overview of prodrugs? The concept of prodrugs. How do we define a prodrug? It's a pharmacologically inactive compound that is converted to an active drug by a metabolic transformation. That's a pretty good definition, and that matches what we've said before in this course. The activation process could be non-enzymatic, like hydrolysis of a functional group, so that doesn't necessarily need an enzyme. It could be just water, does it? But that would probably make the drug inherently unstable. So some functional groups, like an acid chloride, for example, will readily hydrolyze, but that's also a very electrophilic functional group, and maybe it would be toxic to us. Prodrug to drug conversion can occur before, during, or after the absorption at a specific site in the body. Ideally, it should be kind of right where it's needed. And then carrier-linked prodrugs are compounds that contain an active drug linked to a carrier group. It could be a small little fragment of the molecule. It could be maybe larger, but it can be cleaved enzymatically. That's typically what happens with these kind of prodrugs. typically in ester cleavage too. Ester cleavages are really easy to occur with esterase enzymes. The prodrug to drug conversion can occur before, during, or after, also at a specific site in the body, but this is usually enzymatic. Then we have bipartite and tripartite drugs. So bipartite has kind of a drug component and like a carrier component, which is usually a small fragment of the molecule. And then these get cleaved somewhere along the way. And it's a one-step cleavage. So the two pieces just get kind of cleaved, and then you have your drug. So a tripartite prodrug would have a drug, some kind of a linker group. It could just be an atom or two, or maybe a more substantial set of atoms, and then a carrier. And this is usually a two-step cleavage. So maybe the linker-carrier linkage gets clipped first, and then the other part just sort of falls off. Then the linker usually spontaneously gets chopped off. So that's what we mean by bipartite and tripartite prodrugs. And then there's also these bio-precursor prodrugs, which are more substantially metabolized to the active drug substance. So it's usually maybe oxidation or reduction. It's kind of like a more sophisticated, or like a P450 type enzymatic metabolism step. Okay. All right, so let's get into these carrier-linked bipartite prodrugs and show some examples of them for these various purposes. Okay, so increased water solubility we'll talk about first. A good example for water solubility is the case of prednisolone and methylprednisolone. These are not the same as prednisone, but they are steroidal anti-inflammatory drugs. Most steroids, like you probably know, are very poorly aqueous soluble, and steroids, are very greasy. They have a lot of these kind of cyclohexane rings that are all fused, and they have maybe this kind of general structure. This is prednisolone and methylprednisolone, and steroids are generally pretty greasy. When you have functional groups like alcohols and carboxylic acids, that does help in terms of aqueous solubility. But these are pralone and depomedrol that have different R groups, so either a hydrogen or a CH3 at this position on the steroid. And these are used as anti-inflammatory drugs like a lot of steroids are. One second. Okay, and in order to be used for treating inflammation in the eye for ophthalmic drug delivery, it needs to be more aqueous soluble than it already is, and that's where the prodrug strategies come in. So they, in order to use this for treatment of eye conditions, they want to make these maybe more aqueous soluble, and that's an example of increased water solubility as a goal for prodrugs. So there's two goals we'll consider when designing this kind of prodrug. Stability in aqueous solution. So when you think about a drug, if the drug or prodrug is not stable for large periods of time, that just kind of creates it makes it impractical, right? We'd rather have a drug that we could have stored, like in solution or whatever, for a large period of time, maybe a couple of years. And the goal here is at least stable up to 2 years with a half-life of 13 years. And that's kind of that would be desired, so we could make this and keep it around for a long period of time without using it. The other thing is, once it is in the body, it should be hydrolyzed kind of rapidly, maybe within 10 minutes or so. And that is another goal. So esterases in the body will cleave it and make it active kind of rapidly. Okay, so in this case for water solubility, let's talk about these prednisolone derivatives again. So these are there's two prodrug strategies that were devised, and let's talk about them both. Attachment of a succinimide group, which is an ester that can be cleaved pretty readily, and also attachment of a phosphate group. Both of these allow aqueous solubility and improve the aqueous solubility. If we think about C log P, which we've talked about a lot, these will decrease the C log P, which enhance aqueous solubility. So what are they? So here are the drugs, prednisolone and methylprednisolone. Okay, so one of them is using methylprednisolone, so this has the methyl group and this B ring of the steroid. And this drug is called solubility. And so what happened was they turned this primary alcohol into this succinimidal ester, which is a sodium salt. This is actually a really nice fragment, and it can be cleaved to the alcohol. What happens is you can store this as the sodium salt. So this is like infinitely stable. Keep it in the sodium salt form, and then when dissolved in water in the body, the carboxylate sodium salt gets converted to a carboxylic acid, and then this oxygen kind of swings in and kicks us off and generates methylprednisolone, which is the active pharmaceutical. And so it's in this kind of this sort of container, and you would add water to it, probably by syringe, first to dissolve it, and then you would administer it. And then there's another way to do it. This is, rather than methylprednisolone, this is normal prednisolone, so there's no methyl there. And this is a phosphate form. So they just basically attach a phosphate, it's the disodium salt, and then this is totally aqueous soluble. But then phosphatase enzymes in the body would cleave it to make the active pharmaceutical. So these are both kind of cool ways to deal with the solubility issue of prednisolone. And this is called Pediapred, the prednisolone sodium phosphate solution. Interestingly, one disadvantage of solubility is it's so when you would purchase it or use it as a drug, it's provided as a lyophilized sodium salt, which means it's a powder, I guess, and you need to before you use it, you have to add water to dissolve it, and it's kind of disadvantageous because it's like an extra step to use it. The phosphate derivative, to my knowledge, is actually much more stable. So it's stable as an aqueous solution, an oral solution in this case, and used orally. And it doesn't have the, it's not like you have to reconstitute it into water to use it. Okay, so another example of a prodrug strategy to increase water solubility is etoposide. It's a anti-tumor drug, and this is the structure of it, and it so in this case they basically I think they also use a phosphate for this one, and so they have a phenol down here, and they just basically attach a phosphate to it. So then it's called etopophos, and that kind of solves the a lot of the solubility issues of this. So it's a kind of poorly aqueous soluble initially. When they add a phosphate, now it's aqueous soluble. And it's the same kind of thing. Interestingly, you can also just take etoposide, and it says has been formulated, should be been formulated. It's been formulated as a drug using a couple different reagents. Tween 20 is a detergent, which kind of like dissolves it. Like it should be able to dissolve it, and you'd administer it as a suspension in Tween 20. PEG is polyethylene glycol, which is also kind of a biocompatible solvent. You can also use ethanol. When you're using this in sort of large quantities, these reagents can be kind of toxic. And the point is that as a phosphate derivative, it's actually a little less toxic. So it's delivered more concentrated over a short period of time. So in this form on the right, it's actually a little more effective as a drug, more usable. It's cleaved in vivo by phosphatase enzymes to give the active pharmaceutical. So phosphates are actually a pretty cool approach to this as a cleavable functional group. All right, so then what about improved absorption and distribution? So prodrug strategies that just help the drug get absorbed initially, not necessarily solubility. So when you think about skin, one of the functions of skin on our body is to prevent absorption of bad things, xenobiotics. So these are external molecules into our general circulation, and this is sometimes a barrier. Because sometimes we need a drug to get through the skin, but if your skin is preventing drug absorption and you need a drug to get in, sometimes you have to play around with the drug structure and maybe use a prodrug strategy. So fluoquinolone acetonide is a topical anti-inflammatory drug. So it's another steroid type derivative. It's used for anti-itching conditions, dermatitis, but it doesn't absorb properly through the skin. So we're going to consider a prodrug strategy that allows it to go into the skin easier. So this is fluoquinolone acetonide. The acetonide part is this, which is a acetonide functional group or a ketal. Anyway, it's just another steroid. It's also called Silonar as a cream, but the prodrug strategies can improve its ability to go through the skin. So the prodrug strategy is basically attaches just like an acetate or something to this alcohol position, something simple like acetate that can be cleaved by an esterase. And it makes it a little more greasy, and then the skin is non-polar, and so this transports into the skin more readily. So this is called fluoquinonide. Fluoquinonide is the name of the prodrug, or Lidex. So it's absorbed through the skin, and then esterases cleave off the acetate and give you the active hydroxy group and fluoquinolone acetonide drug. Okay, another example. Epinephrine is a neurotransmitter, and it used as an anti-glaucoma drug, but it doesn't absorb well into the eye. So how do we fix that? If it doesn't absorb well, we basically make it a little greasier, and then in a way that can be cleaved by our body and our eye, and then that works really well. So the prodrug, in this case, they use tert-butyl esters or pivyl oil groups. So it's called dipivyl oil epinephrine or propine, and this allows more efficient absorption. So it's kind of like an eye drop type derivative that you add to treat glaucoma. And then these also get cleaved by esterase enzymes. So So these are the propine eye drops, ophthalmic solution. And esterase enzymes cleave the ester groups to liberate the drug. Site specificity. So if we want a drug to actually interact with a site of interest, a drug target. This is an interesting one. This is oxyphenysatin, which is a intestinal antiseptic drug. It's generally only active when it's administered rectally, which people don't usually like. They'd rather maybe administer it orally or some other way. But orally, it doesn't survive first pass metabolism. So people created a diester prodrug version called Levima, which allows it to be administered orally. Then it gets hydrolyzed in the intestines, which is pretty remarkable, by esterase enzymes, and then it's active as a antiseptic drug. So the prodrug is basically just the diacetate version. So this is orally active, and it serves as an intestinal antiseptic drug. Site specificity, another example. Adefovir is a hepatitis B reverse transcriptase inhibitor, RTI. And this is kind of like what we've seen before, zidovudine AZT, which is an HIV-1 reverse transcriptase inhibitor. So these do the same kind of thing, but they're different viruses, hepatitis virus versus HIV virus. So it's very polar and not orally bioavailable. So prodrug strategies were developed. And this is the drug. You can see why it might be really polar, because we have the phosphorus and the two hydroxy groups and all these hydrogen bond acceptors, and not absorbed very well. And if you need it to be enter circulation in your body, it needs to absorb. And so the prodrug strategy for this also uses these sort of pivyl oil ester groups. Another one, this is called Hepcira. Another one, kind of, rather than having two of these sort of esters, uses sort of a cyclic ester type, a cyclic phosphorus ester with a 4-chlorophenyl group. And so both of these are prodrug strategies for a phosphate that's actually present in the drug. And interestingly, this left molecule is orally available, but it has liver toxicity issues. And if you're trying to treat hepatitis with this, any kind of liver toxicity is going to be bad. We'll show this in a second, but this is actually an example of a tripartite drug strategy. So remember that it's like a three-part drug, prodrug. So there's kind of like the drug part, including the phosphorus. This little guy here, the CH2, these are linkers. This is a CH2 linker, and this gets cleaved as well as the terpetal ester. And then this generates formaldehyde. A little hard to see here. I think I showed it in the next slide. And formaldehyde, as we know, is an electrophile, and electrophiles in the liver cause toxicity. And so this is, for a liver disease like hepatitis, this is kind of bad. So this is not necessarily the best prodrug strategy. This strategy actually doesn't have that issue, so this works a little better. So Defovir activates the prodrug activates in a manner that avoids liver toxicity. So let's show that. And here's the Defovir. Here's that prodrug strategy again. And here's Defovir and prodefovir. And this CH2 linkage, which you haven't seen before yet, this makes it actually a tripartite drug, prodrug strategy. So both these CH2s get kind of cleaved, and in the process, so the esterase cleaves the ester, and then this cleaves to make formaldehyde, acetyl 1,2, right? This does not have that problem. And here's a pathway for prodefovir that uses glutathione to scavenge the electrophile. And that's why this is maybe not less toxic. Prodefovir doesn't have this toxicity issue because glutathione is able to kind of scavenge this part. We'll see that in a second. Formaldehyde, as far as I know, doesn't get attacked by glutathione. Glutathione's a nucleophilic cofactor, remember? Here's a pathway for how prodefovir is degraded or activated by by metabolism that avoids liver toxicity. So here it is initially. It's this kind of cyclic phosphorus ester thing. CYP3A, of course, is a cytochrome P450 variant. It's an isoform. So what that does is it activates this CH right here, and it hydroxylates it. So that's one of those oxidative metabolism pathways that we talked about before. So it hydroxylates. And why there? Why does P450 like to metabolize right there? It's next to a benzene, so it's right there as well. And being next to a benzene, this is a stabilized radical. So this position is a very stabilized radical. The chlorine may actually help it also. It might stabilize the radical a little bit more. So as a stabilized radical, then it gets oxidized again, lose the radical, makes a carbocation, and then the water attacks the carbocation, and you get this sort of alcohol. Well, anyway, base will take this proton and then kick this off to make a ketone, and then sort of open up the ring, and then another basic, maybe amino acid or something, will take this proton, eliminate, and now you've generated the active pharmaceutical adefovir, which is in the phosphate form. That's what 9.25 is. But that creates an active electrophile. This could be liver toxic, right? Except for the fact that glutathione will totally react with this electrophilic intermediate. So glutathione's nucleophile attacks, sort of in a Michael addition manner, attacks the alkene, kicks the electrons onto the ketone, and then makes the glutathione adduct. So this is perhaps how these derivatives, or how prodefovir avoids liver toxicity during its metabolic activation. Okay, another thing that prodrugs are used for is to improve stability of a drug. And propranolol is a beta adrenergic receptor antagonist or beta blocker. We've talked about this class of drugs a few times. So they inhibit the beta adrenergic receptor, and this is used kind of as a antihypertensive drug. So it's significantly metabolized through first pass mechanisms when taken orally. So we get glucuronidation, hydroxylation. This can all be avoided if the drug is taken IV. Anyway, this is the structure of the drug. It has this naphthol group and a hydroxy group. And I think we looked at something like this in one of our computer programs. Maybe it was a tenolol, but they all kind of, a lot of the beta blockers have this general structure, secondary alcohol and a amine with some group, either a isopropyl or maybe a tert-butylamine over here or something. So this is called indurol. So the possible metabolic steps would be, glucuronidation or maybe sulfate formation of the hydroxy group, possibly even aromatic hydroxylation. And so the prodrug strategy is, again, uses this succinimidal ester group, which we've talked about earlier when we talked about, I think, prednisolone. And so this is nice because I think, like, as a drug, you can keep it as a sodium salt when it's before you actually administer it, and then it's under aqueous conditions, the maybe inside the body, after it passed through the intestines, the hydroxy group can swing in and kick off the carboxylate. So this oxygen attacks and kicks this off, and then you make the drug. So it's a hemisuccinate ester. Hemisuccinate esters are a pretty common prodrug strategy for alcohols. And it blocks first pass glucuronidation. And in this case, this drug, the blood plasma levels were 8 times greater, which is actually a pretty significant effect, right? If you take this, or take this, or take 1/8 of the amount of this, you get the same amount of drug in your blood. So that's a pretty cool example. And look at the mechanism of metabolism for solubility, which is prednisolone, or one of those prednisolone derivatives a couple slides ago, for how this works. Another example of improved stability. Naltrexone is a mu-opioid receptor antagonist, so it's used in addiction treatments for opioid drugs. It's well absorbed orally, but it's significantly metabolized. So this is naltrexone, Ravia. And so what would you imagine might be the first pass metabolism? I don't know. What do you think? Maybe one of these, like oxygen, this phenol, or the tertiary alcohol could maybe act as nucleophile, get glucuronidation or something like that. Anyway, in the prodrug strategy, they simply attached 2-aminobenzoic acid and made an ester. And so now you can, this simply blocks that glucuronidation, right, on the oxygen, which is pretty cool. And then another way to do it is with aspirin. So they actually attach aspirin, right, through an ester linkage. So both of these are prodrugs for naltrexone. And they enhanced oral bioavailability 45-fold to 28-fold respectively. So this left one actually worked maybe even better in terms of allowing the drug to survive first pass metabolism and make it into general circulation. It's pretty cool. Prodrug strategies for slow and prolonged response. This is an interesting one. So maybe a drug that you kind of want in your system for a long period of time to have a therapeutic effect. There's ways we can do that. This is really clever, I think. Okay, so if slow drug response is desired, a strategy is to attach a long and slowly hydrolyzed ester chain. These are antipsychotic drugs used in psychiatric treatment, haloperidol and fluphenazine. They are peak plasma level at 6 to 8 hours, so kind of, and then they get degraded and metabolized away. So the drugs look like this, haloperidol. I'll show the other one in a second. So the prodrug strategy is simply attach a big long ester, a decanoate group. I think it should be 10 carbons. Let's see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yeah, decanoate. So it's 10 carbon chain ester. So what happens then is you administer this drug, and it gets kind of absorbed into your fatty tissue and can last a long period of time and sort of do a slow, prolonged release. Fluphenazine has another kind of, it looks a little different, and it has a primary alcohol on it, and you do the same kind of thing on this primary alcohol. So this is fluphenazine decanoate, and I think, yeah, these long chain ester prodrugs cause the drugs to be stored in fatty tissue, increase the duration of activity to a month. So in the case of like a psychiatric drug, it's kind of nice to have an extended period of activity. Minimizing toxicity. So using a prodrug strategy to minimize toxicity, how might that work? So the the prodrugs we showed earlier, and we talked about propine, which was used as a epinephrine prodrug. A point we should mention is that when you take a drug that kind of enhances absorption, like propine, like we mentioned, you can take less of it because epinephrine has some side toxicity effects, and by being able to administer less of a drug, if you get a decrease in toxicity, well, that's kind of cool. Okay, so toxicity is dose dependent. If prodrug can be administered in smaller dose, then toxic side effects are less severe. That's just an example of this previous prodrug we talked about, propine. And epinephrine in high dose is toxic, and this decreases the required dose. Encourage patient acceptance. What do we mean by that? For drugs to be effective, patients need to take it. And if you have maybe a negative consequence of taking the drug, like tastes bad or tastes kind of bitter, or it smells bad, people won't want to take it as a drug. And so sometimes we can get rid of that, like an unpleasant taste or odor, or a painful injection maybe. And those are reasons that a patient might not want to take a drug. So clindamycin is a broad spectrum antibiotic with very nasty taste. It's sort of a bitter chemical taste, and people don't like that. If you attach a phosphate or palmitate group, that resolves that. So here's the drug, and I think they would just attach it on one of these hydroxy groups, and that kind of decreases the flavor issues. So like attaching a phosphate group to this oxygen on the sugar makes it more palatable. And this drug is called Dalacin, which is simply the phosphate of clindamycin. Clindamycin palmitate is the same exact thing, but now with a palmitate ester. I think that's, I forgot how many carbons that is. 1, 2, 3, 4, 5, 6, 7, 8, 11, 12, 13, 14. I think it's 15 carbons. And this also gets rid of some of the negative flavor effects. It's called Cleocin pediatric solution. Another example is sulfadrug sulfisoxazole, and all the sulfadrugs, as you know, interfere with folate metabolism as an antibacterial mechanism. So it has a bitter taste, and whereas the acetamide is tasteless, which is kind of cool. So this is the sulfadrug, and simply having a acetate group on this nitrogen, and this is a pretty easily cleavable amide linkage, gets rid of the taste issues. It's pretty crazy. So this is readily cleaved by peptidases or amidases. And in clinical use, this is combined with erythromycin, which is another antibiotic, and this also has a kind of a nasty taste. But they add a ethyl succinate group, and this is kind of like that. What is this like? The succinimide or hemisuccinate? I think we called it hemisuccinate that we saw earlier. So this is a succinate type derivative on erythromycin, which is another antibiotic, and so these two drugs are combined, and it actually into a strawberry banana suspension, which I guess is, I don't know what it tastes like, but I'm sure it's pretty good if it tastes like strawberries and bananas, and it's called Omnicef or Pediazole. So it's kind of like maybe a child-friendly antibiotic mixture for bacterial infections. Okay, so let's show carrier-linked tripartite prodrugs. Carrier-linked tripartite prodrugs. So what do we say about tripartite prodrugs? They kind of have three pieces. They have the drug part, a linker, and then a like a carrier part. So carrier, a linker, and a drug part. And then usually what happens is the enzyme will cleave off the carrier, and that makes the second step more spontaneous. Overall, this is a nice idea because it sometimes if you do a bipartite prodrug, just like a two-piece one that's cleaved by an esterase, sometimes that's cleaved very rapidly, and that is undesirable. So this sometimes can slow down the cleavage process in a tripartite prodrug strategy. So it often looks like this. Very commonly, you have a drug and then a X, like an NH, or an oxygen or some other, like maybe an ester or something, and then a CH2 and then like another ester. And so the esterase enzyme will cleave this and make this kind of hemiacetal intermediate, which is not very stable, and then this will cleave very rapidly. So O- kicks in, breaks this off, and then you make formaldehyde in your drug. Remember, we had that situation where, like for hepatitis drug, formaldehyde is kind of toxic, so that's not very desirable. And then, in this case, carboxylic acid byproduct. So this is kind of what a tripartite prodrug looks like. Let's see an example. Let's show ampicillin as, which is one of these penicillin derivatives, and a tripartite prodrug strategy for this. Okay, so penicillin derivatives are very poorly absorbed because they're polar. It's almost like a weird amino acid type thing with an amine and a carboxylic acid. And if you attach a bipartite prodrug strategy maybe to the carboxylic acid or something, it usually gets cleaved kind of rapidly, and so this is not necessarily a good bipartite prodrug. Well, if we have some other carrier group here, this usually necessitates higher doses, which if we're taking these drugs orally, can kill the central intestinal gut flora. So, being an antibiotic, you have to kind of be careful about this doing nasty stuff to your stomach, and especially if you have to take it in high doses to aid absorption. So a tripartite strategy kind of slows the initial cleavage reaction if we attach a prodrug to the carboxylic acid. So one of the prodrug strategies is like this. So we have the amine remains just like a normal amine, an NH2 group. So here is now you can see the tripartite prodrug strategy. So we have this is kind of like, this isn't formaldehyde when it gets cleaved, it's acetaldehyde. It's going to cleave to a 2-carbon aldehyde, then you have an ethyl ester. Okay, and so esterases will cleave this, but it usually does it a little slower than if you don't have the middle piece. So the esterase cleaves the ester and makes this kind of carbonate ester, and it's like an ester of carbonate, right? And then this gets cleaved, and you have this hydroxy group. This is a hemiacetal. So the oxygen kicks in very rapidly and spontaneously, and this generates acetaldehyde. This thing falls apart with the ending of the arrow, but the oxygen kicks in to make CO2 and ethanol. Okay. This is actually a pretty cool trick to bypass, or to actually pass through the blood-brain barrier. This is a slight twist on that last method, and it's also used for antibiotics. This is a idea developed by Boder. His papers, Annals of the New York Academy of Sciences, 1987. All the references and all these PowerPoints are all on the iLearn site. Anyway, so remember the blood-brain barrier is very nonpolar, and when you want a drug to pass into the brain, into brain tissue, it needs to be kind of greasy and nonpolar as well. And so this method by Boder, I think I misspelled his name here, uses dihydropyridines, and it's a pretty clever technique, I think. So here you'd have like a drug molecule conjugated through some sort of X group, and this is a dihydropyridine, so it's a sort of greasy type derivative. This can be greasy enough to cross into the blood-brain barrier. So this will make it into the brain, and then oxidation enzymes, maybe related P450, within the brain tissue will actually then oxidize the dihydropyridine into a methylpyridinium species. So this is a charged thing. These charged things will not leave the brain, and then this can be hydrolyzed really easily. I think the positively charged nitrogen even activates this for hydrolysis. So some kind of esterase or amidase will cleave this carbon X group and then leave you with the drug. So this is kind of developed as a novel idea for getting drugs into the blood-brain barrier, passing through the blood-brain barrier. And here's an example of it. Delivery of beta-lactam antibiotics for treatment of bacterial meningitis, which is a bacterial brain infection. And so kind of penicillin type derivatives like this can be attached, and this is a tripartite prodrug, because you can see the CH2 there. So this will degrade to make formaldehyde, and it's delivered in this sort of dihydropyridine form, which is greasy and able to cross the blood-brain barrier. This, inside the brain, will be oxidized to the methylpyridinium. This is now readily cleaved to make the to cleave here and make this sort of hemiacetal group, the carbon with the two oxygens. And this cleaves to make formaldehyde, and then you've basically delivered a antibiotic into the brain, which is a pretty cool thing. This is totally impossible otherwise. There's other strategies to do this, but generally speaking, if you have a very polar group like an antibiotic, like a penicillin derivative, this would be really hard to get into the brain. Anyway, so Boder, he did a couple papers. The full references are in the PDF file. They're JMed Chem 1989, 1774, and 1782. And you can read about this more if you're interested in it, this prodrug strategy for crossing the blood-brain barrier. Another example of a carrier-linked tripartite prodrug strategy. So you've learned about 5-fluorouracil, probably a couple times in this course. It uses an anti-tumor drug. It's sort of like a nucleotide analog, so I think it looks like uracil, if I recall. And but with the fluorion, it's non-natural, and it's pretty effective anti-tumor drug, because this sort of prevents and interferes with the rapid replication in a tumor cell. Anyway, it's also used in skin infections. So certain kind of nasty bacteria or fungi, we can actually use this and feed it into the bacteria or fungi, and that'll kill them. And so microorganisms, interestingly, they have these enzymes called permeases, which uptake peptides pretty non-specifically. So they will kind of sneak right into the enzyme, into the fungus or bacteria, using permease enzymes, and they work. I think that are specific for L amino acids, like peptides with L amino acids. And this can be used in a prodrug strategy. So basically what we're going to do is take 5-fluorouracil and sort of attach it to a peptide type derivative. And then that gets fed into the bacteria or fungus. Okay, so here it is, 5-fluorouracil sort of attached through the nitrogen to this sort of peptide looking thing. It's obviously a non-natural peptide. And permease allows it to get absorbed into the skin, so and into the bacterial cells and fungus cells. And then once it's inside, peptidases will cleave it. It'll cleave the peptide. So there's this kind of alanine linkage right there. So that'll generate alanine, and then this just degrades spontaneously to kick off the 5-fluorouracil, and then this has a super toxic effect, just like it does to tumor cells, also to bacteria and fungi. Okay, I think I'm going to stop this a little early today. We'll continue the bioprecursor prodrugs section next time, and then move on to the case studies. Okay? All right, see ya.